Hello and welcome. Today we're diving into a sensitive and often debilitating condition affecting the urinary system, bladder fistula. This video will provide a comprehensive overview, covering everything from its causes to treatments, so you can better understand this complex issue. So, what exactly causes a bladder fistula? The most common culprit is prolonged obstructed labor, particularly in regions where access to quality obstetric care is limited. However, other causes include surgical complications, particularly after pelvic surgery like hysterectomies or cesarean sections. Radiation therapy for pelvic cancers can also damage tissues and lead to fistula formation. Inflammatory bowel diseases like Crohn's disease, traumatic injuries, and even certain cancers can contribute to the development of a bladder fistula. To understand the condition fully, we must look at pathophysiology. In essence, a bladder fistula is an abnormal connection between the bladder and another organ or structure. This connection allows urine to leak outside of the bladder, bypassing the normal urinary tract. The continuous exposure of surrounding tissues to urine can cause inflammation, infection, and further tissue damage. The type of fistula determines where the urine leaks. For example, a vesicovaginal fistula causes urine to leak into the vagina, while a vesicoder fistula causes urine to leak into the uterus. Let's talk about epidemiology. While precise global statistics are difficult to obtain due to underreporting and varying diagnostic capabilities, bladder fistulas are significantly more prevalent in developing countries, particularly those with limited access to skilled birth attendants and emergency obstetric care. In these regions, obstructed labor remains the leading cause. In developed countries, bladder fistulas are more commonly seen as complications of pelvic surgery or radiation therapy. The signs and symptoms of a bladder fistula can be quite distressing and significantly impact a person's quality of life. The most prominent symptom is continuous, uncontrollable leakage of urine, which can occur through the vagina, rectum, or even the skin, depending on the fistula's location. This leakage can lead to skin irritation, infections, and a persistent unpleasant odor. Other symptoms may include pain, recurrent urinary tract infections, and, in some cases, fecal incontinence if the fistula involves the rectum. For women, the condition can also cause significant social isolation, depression, and difficulties with sexual function. Diagnosing a bladder fistula involves a thorough medical history and physical examination, often including a pelvic exam for women. Several diagnostic tests may be used to confirm the diagnosis and determine the fistula's location and size. These include a dye test, where a dye is instilled into the bladder to see where it leaks, cystoscopy, a procedure where a small camera is inserted into the bladder to visualize its lining, imaging studies like CT scans or MRIs, and voiding cystoarthrograms, which use rakes to visualize the bladder and urethra during urination. Bladder fistulas can be classified based on their location and the organs they connect. The most common types include vesicovaginal fistula between the bladder and vaginal, vesicoder fistula between the bladder and uterus, vesicorectal fistula between the bladder and rectum, and ureterovaginal fistula between the ureter and vagina. While technically not a bladder fistula, it's often considered alongside them. The size and complexity of the fistula also influence the classification and treatment approach. Treatment for a bladder fistula typically involves surgical repair to close the abnormal connection and restore normal urinary function. The specific surgical approach depends on the fistula's location, size, and the patient's overall health. Small fistulas may be repaired laparoscopically or robotically, while larger or more complex fistulas may require open surgery. In some cases, a temporary urinary catheter may be placed to allow the tissues to heal properly. In certain situations, conservative management with bladder drainage may be attempted, but surgical intervention is usually necessary for a complete and lasting resolution. Preventing bladder fistulas, especially in developing countries, hinges on improving access to quality obstetric care, including skilled birth attendants and emergency cesarean sections when needed. Early recognition and management of obstructed labor are crucial. In developed countries, meticulous surgical technique during pelvic surgeries and careful radiation planning can help minimize the risk of iatrogenic fistulas. Education and awareness campaigns about the risk factors and symptoms of bladder fistulas can also help individuals seek prompt medical attention. The prognosis for bladder fistula repair is generally good with successful surgical intervention. Most patients experience significant improvement in their quality of life and regain urinary continence. However, the success rate can vary depending on the fistula's complexity, the patient's overall health, and the surgeon's experience. Recent research is focusing on developing less invasive surgical techniques and exploring new biomaterials to improve fistula repair outcomes. Additionally, Ongoing efforts are aimed at preventing fistulas in the first place through improved maternal health care and access to skilled birth attendants in underserved communities.